following segment is sponsored by Intermountain Healthcare.
Hey, welcome back. Ask the Expert today is about maternity and pregnancy, and we have the expert nurse Dani here to talk a little bit about contractions. And some people talk about Braxton Hicks, and some might just be muscle. What are they? Early contractions.
So Braxton Hicks contractions, probably most women experience them at some point, and it's a contraction. A contraction is a contraction is a contraction.
Doesn't that mean you're in labor?
Right, it doesn't. And so
Okay.
a lot of people start to freak out about it. And the difference is just the intensity and frequency. So Braxton Hicks are infrequent and not painful, just uncomfortable. They might take your breath away. And if you're having a few a day, even when you're preterm, that's okay. But if they start to become regular, that's when you pay attention, or if they get more intense. So if you're preterm or less than 37 weeks and you're having 4 to 5 of those an hour, you're having cramping, tightening, pressure, you need to get checked.
Okay, you might not be in labor, but you might be.
Right. Well, yeah, we want to make sure. Right. That's the whole thing. The true definition of labor is cervical change as a result of contractions. And so if you're preterm, we don't want you to be contracting. Right. And we don't want your cervix to change. So that's why we want you to get checked out sooner rather than later. Okay.
What other kind of cramping and pain should you go get checked for? Like some people say they have contractions in their back, or
yeah, you might have back pain that starts in the back and moves to the front, or it might start in the front and move to the back. If you have sometimes pain in your thighs, along with pressure, all of those sensations are associated with contractions. But if you're over 37 weeks, then you can be excited about it, right? Because you want to have the baby. So at that point, if you're having contractions every 4 to 5 minutes and they're increasing in intensity, then it's time to go see if your cervix is changing.
Okay, there are a lot of old wives' tales and what mom or grandma might have gone through. You guys know the real deal.
Yes, we do. And the only way to really tell if you're in labor or not is by coming in to see us. You can't tell at home.
Right. And you can always ask them if any questions with Intermountain Moms.
Yes, I'd be happy to.
How do people get a hold of you? It's on Facebook?
Yeah, facebook.com/Intermountain Moms.
Okay, and that's part of our Ask the Expert. These people have the answers to any questions you might have about pregnancy. I know some people will call a neighbor or call a friend, and every pregnancy is different. Something might happen to this pregnancy, didn't happen last one. You can call and ask the questions today.
That's exactly right.
Okay, Nurse Dani and the other experts here till 5:30 this evening. Guys, back to you.